Dr. Manish here, consultant physician and diabetologist working in Vinay Multi-Speciality Hospital, Hassan. Today, we are here to give an awareness talk on hepatitis. Every day, hepatitis cases being increased from infective to non-infective. Many doctors in the periphery as well as in the tertiary care center, they are struggling hard to give good care on the hepatitis. Why is hepatitis important? What is hepatitis important? So first learn about hepatitis. Hepatitis is the inflammation of the liver parenchymal cells. So why it will happen? What are the causes? So one is infective. Infective in such we have A, B, C, D, E virus, of the which C and D is most important. It doesn't mean that A, D, E are not important. These are all self-limiting with good hydration, good proper rest, and good multivitamin supplementation. They improve quite well. And B and C, these are all having quite a long duration. Prognosis is also not that good. So for that, there is a proverb in English: prevention is always better than cure. So for hepatitis B, we have hepatitis B vaccination. So I request all of you, those who are working outside and those who are having repeated contact with the animal handlers or transport people or those working in hospital setup, I request you all of you to get yourself hepatitis B immunoglobulins immunity test. If it is very less, consult the nearest physician, get the hepatitis B vaccination. So it is on first zero dose, first month, second month, third month. And hepatitis C, for that, why it will transfer, how it will transfer. It is only with a person who is, or he or she is infected, he can carry this virus to other person only during bodily fluid exchange. So one such is the transfusion and unprotected sexual contact with the unknown people. So that becomes one of the highest risk. So whenever in that situation, use proper protections. And if you are using certain blades, syringes of unknown person or known person, I request all of you to cut down that. So with this, at least we can prevent infective causes for hepatitis B and C. So A, D, and E, how it will transfer? It is, in medical terms, we call it as fecal-oral transmission. That is, whenever the food or water is being contaminated by a person who is already carrying that virus. So if you are having that condition, make sure you use a proper sanitation method to store water, as well as whenever you are able to, whenever you want to drink water, make sure it is good hygiene and potable, and it is not with any impurities. If you are at the risk of catching that, boil the water. Even small unknown viruses will be destroyed. You can prevent that. So A, D, and E. So other than that, hepatitis can also be due to our lifestyle. We are, in the current days, we are seeing many people who are not getting enough time to do workout. So they are in a hurry always. There's always in a hurry, in a worry, and they have less time to eat the proper curry. So in this fashion, they keep on accumulating the fat being stored in the liver, which is even more required. So this will trigger inflammation, as I said. So what we call it as non-alcoholic steatohepatitis. This is one of the dangerous conditions. So I request all of you to make sure that you eat on time, reduce your stress, and also make sure that you reduce the saturated fat intake in your diet. Do daily exercise. And most important we come across is alcohol. So for the alcoholic hepatitis, and many people are landing up in cirrhosis. And for that, the prognosis is very poor. They land up either in a transplant or they have to visit hospital very frequently. And cost burden will on the patient as well as patient attendant too high. So considering all of this, at least we'll make a pledge. This 28th July, we'll make sure we will vaccinate ourselves with hepatitis B if you are not vaccinated earlier. Reduce alcohol intake and make also sure that you exercise regularly to keep yourself fit. Thank you.